and gynecologists are me. Why people like Hi everyone and welcome to the first ever video of the Doctors React series for the Rotaract Club of Medicrew, and today we have with us.
Hello, I'm Dr. Sarita Bhalerao, practicing gynaecologist in Mumbai.
And she is going to react to the craziest things we've heard about menstruation, PMS and gynecologists in general. So without further ado, let's just get started. First myth that we've heard about periods is that your periods come earlier if you eat pickle.
I don't think that's true. That doesn't make sense. It's not related to what we
Have you heard that before?
Well, there are some tales and stories like that, but there's no scientific evidence behind that.
Then if you tie a dhaga around your ankle.
No, I don't think that's possible either.
Okay. Then you can't swim on your period.
Well, we have competitive swimmers who sometimes do have to swim during the periods, and they do manage to swim.
Oh, how do they do?
Well, either they can use a tampon to absorb the blood flow, and they can swim.
Okay. Then one crazy myth that every single person has heard is that friend groups of women living together have synced up periods because of pheromones. Is that true?
Well, no, I don't think so. I haven't heard that.
Never? Nothing? Okay. So it's just a coincidence. Okay.
Yes.
Then, is it normal for periods to be very painful?
Yes, periods can be very painful. They can be painful in young girls on the first and the second day of the period. That is called dysmenorrhea. And sometimes it could be very painful when there are abnormal conditions like adenomyosis.
So you should get it checked.
Yes.
Okay. Periods can trigger asthma.
Yes, that is true. Hormonal changes can trigger asthma.
Okay. It's bad to have sex on your period.
No, well, it may be a little bit, unhygienic, or it may be difficult, especially if there's heavy flow. But otherwise, there's no danger.
Okay. Another myth, or I don't know if it's a fact, is that it's impossible to get pregnant on the period.
Well, that's not the fertile part of the cycle, so it is quite difficult to get pregnant during the period. But since some women ovulate quite early, and since the sperms last for 72 hours towards the end of the cycle, if they happen to ovulate early, they could still be a pregnancy.
Okay, so you should use protection even if you're on your period. Irregular periods mean you're going to have a hard time getting pregnant.
There is some truth in that, because irregular periods can often be due to polycystic ovaries, and with polycystic ovaries, if it's untreated, then sometimes women have difficulties in conceiving.
Now, some crazy myths that we've heard, which are menstrual cramps are women rejecting their femininity.
I think that's
Crazy?
crazy.
Okay. Menstruating women attract bears.
What?
And sharks will attack women on their periods.
Well, these are all sort of theories, and this is because the sharks are attracted to the smell of blood.
But menstruating women can control the weather.
No, I don't think so.
Menstruating women can cure the plague.
No, that's impossible.
Yep, but it's all a myth. Then there are some myths about PMS. One is PMS even a thing?
PMS is a known disorder. And yes, premenstrual symptoms are very common. In almost 50-60% of women get some sort of premenstrual symptoms, but they can be troublesome in a smaller percentage, maybe 10% or 5%.
So it happens to every woman every
Yes, there's always a premenstrual phase, and there's a change in hormones, and that could cause some symptoms.
Some people think that PMS is the same as your period.
No, premenstrual symptoms are symptoms which occur in the second half of the cycle, the luteal phase of the cycle. So they are not. It's not the same as getting the period.
And PMS only includes mood swings.
No, there are so many symptoms: water retention, weight gain, breast tenderness, mood swings, depression. And lots and lots of symptoms.
And
They could be physical symptoms, emotional symptoms, mental symptoms, many.
Okay. And the last myth is nothing can be done about it.
No, I think that's a complete myth because we do have treatment and there is a lot we can offer patients. Like medications, hormones, tablets, lifestyle modifications.
So if someone were having really severe menstruation before they period, they should talk to a
Yes,
gynecologist.
of course they must.
So don't just let it go. Talk to someone. And there are a lot of myths about menopause. One is that menopause is an illness.
No, menopause is a natural transition.
Okay. Menopause makes every woman's life miserable.
Not at all.
You can only have painful sex after menopause.
Not at all.
So what about vaginal dryness?
Well, there are ways of treating vaginal dryness. There are lubricants that we give. There are some treatments. Sometimes we give local estrogen creams and ointments also.
It means you're officially old.
It means you're getting older.
But okay. And some people think that you can't tell the difference between early menopause and being pregnant.
Oh, there's the only thing in both, you may not miss a period. So if somebody has missed a period, then we have to, before we say that it's menopause, we have to check for pregnancy.
General myths about OBGYN. So we want to know. One is that you have to be above the age of 21 to go.
Not at all.
And you don't need to have regular checkups.
Well, you need, if you don't have any problems and when you're young, you don't have to have regular checkups. But if there's any issues, one should.
Okay. Birth control pills decrease your fertility over time.
No, not at all.
Okay. Only pregnant women visit gynecologists.
No, not at all. So many other patients.
Pap smears are extremely painful.
Not at all.
And there are these images that people have where they're scared of a pap smear. They're scared of the gynecologist.
No, I don't think they should be scared. It's a very simple, easy test to do.
Gynecologists can tell if you're a virgin or not.
Well, when we examine a woman, we can tell whether the hymen is intact or the hymen is not.
Gynecologists care about grooming down there.
No, not at all.
So pubic hair isn't something that you guys don't like to see.
Not at all.
Okay. The entire fraternity gossips about their patients to them.
Not at all. There's a confidentiality clause and we never talk about patients to each other.
And gynecologists are mean. Why? People think really? And some people think gynecologists are scary.
Really? No,
Yeah.
I don't think so.
Okay.
And why are you scary?
No, you don't. I don't know. Gynecologists will comment or judge you based on how pink or how attractive your vagina is.
Not at all. I don't think so.
So, okay. And I guess that's all for today. Thank you for making it to the end of the video and thank you for being here. Do you have any last words you would like to
My
say?
pleasure. And think of your gynecologist as your friend.
Okay.
And do visit your gynecologist soon.
Yeah, thank you. Hi everyone, thank you so much for watching that video. I really hope you enjoyed, and if you did, don't forget to like, share, comment and subscribe to our channel for more. Bye!